Bristol Hospital is hosting a free monthly geriatric medicine and dementia educational series. The first session is going to take place next Wednesday from noon to 1 p.m. at Bristol Hospital. But here now, today, this Wednesday from Bristol Hospital, just to talk about the basics of dementia, I'm happy to have Dr. Margarita Reyes, who leads the hospital's geriatric medicine program. A pleasure to meet you. Thank you so much for being with us today, Doctor. Glad to have you here. Okay, well, so just start with the basics for people. I'm sure most people have heard of dementia, but I don't know that they all know exactly what it is and how prevalent it is.
So dementia is the general term for cognitive disorders or cognitive decline severe enough to affect one's ability to function day to day. There are many different types of dementias, and Alzheimer's disease is the most common type of dementia. Other common types are vascular dementia, frontotemporal disease, and Lewy body disease.
Yes. Now, how similar are those three types? Is it, I mean, is there really a difference people need to necessarily understand, a lay person, or they can all sort of look at them the same way?
It's really about decline, functional decline and cognitive decline.
Now, how prevalent is dementia?
So about 10% of people over the age of 65 have dementia. There are 5.7 million people in America with Alzheimer's disease. It's the 6th leading cause of death in the United States.
And this is, I imagine, a growing problem. It's one of those things that tends to be the price of progress that, for the most part, over the last 20, 30, 40 years, Americans are living longer and longer, which just means because of that, more people are going to be diagnosed.
Yes.
So this is something we need to tackle, and there are tests that are available. How does that go about? Are they blood tests or just simple cognitive tests? How does it work?
So a thorough evaluation by a healthcare provider is really what is needed. It's important to gather information, not just from the patient, but also from the family members. And yes, we do laboratory tests to rule out secondary causes of cognitive decline. We also do cognitive exams, which are simple enough to do in the office and are very sensitive in detecting brain function changes. At times, we also do brain scans, such as MRIs or specialized PET scans, and even at times a spinal tap, to try and help determine the underlying cause of the dementia.
Now, before people can get in for tests, I imagine family members need to start seeing some red flags or some alarm bells. What should family members be looking at home in order to be worried?
A decline is really what I look for. So examples of cognitive decline are short-term memory loss, disorientation, word-finding difficulties, mood, personality, and behavioral changes may also occur. And these changes should be severe enough to affect day-to-day functioning with things like work, driving, managing medications, or finances.
Okay. Now, I'm not sure exactly how to ask this, but I think people expect a certain amount of decline like that as people get older. Is there sort of a baseline level that we can say is acceptable? Or are what we're seeing really the early stages of dementia and it's just unavoidable to some degree in everybody? Do you know what I mean?
The message is that everyone has a different baseline, and a decline from that baseline is really what would be concerning. Early detection is key, and so I urge people that if they're starting to sense some changes, then be evaluated by a healthcare provider.
Yeah, I imagine some level of, okay, just forgetting little things in the short term. But yeah, the personality changes, I imagine, would be a very big red flag. Okay, so this is an ongoing series of topics happening at Bristol Hospital. What are you planning to cover specifically on this first one coming up a week from today?
So it's the basics of dementia, about how to diagnose, the different types of dementias, the symptoms to expect. In the next month, we will be discussing medications to give and to avoid. Other upcoming topics are how to promote quality of life, advanced care planning, and how to deal with mood and behavioral symptoms, which can sometimes complicate dementia.
And this is free, open to the public?
Yes.
Good. So anybody can go, and of course, I imagine there's going to be a lot of interest. So once again, next Wednesday, noon to 1, right there at Bristol Hospital there on Brewster Road. Doctor, thank you so much for joining us today. It's a pleasure to have you and a pleasure to meet you.